breast surgery is one of the most popular surgeries out there. Breast reduction, breast augmentation. And here we have Dr. West and Dr. Gaon to tell us the difference between the two and also how some of the procedures are done. Dr. Gaon, what is a breast reduction surgery?
So those are bipolar opposites. The breast reduction surgery is when a woman comes in complaining about the overly large size of her breasts, causing issues such as back pain, neck pain, headaches, deep grooves from the bra straps, moisture that develops under the folds of the breast, and they're coming in really from relief of those symptoms. We treat those just like any cosmetic surgery, but sometimes the insurance will cover the cost of that surgery to relieve those symptoms. And what it is removing excess breast tissue and performing a breast lift at the same time to give the patient a more youthful look, and at the same time relieve your symptoms by taking away the weight of that extra mass.
Okay. Now, what would be the breast augmentation?
So breast augmentation would be the opposite. So a patient who comes in and she feels that she doesn't have large enough breasts. Sometimes it's a very straightforward procedure where we put an implant in, and we have a lot of, as you can see, a wide variety of implants we can use. Sometimes it means putting an implant and doing a lift at the same time. So it really depends on what the patient needs.
Okay, well, you do have a couple of different samples here. So I'm holding a natural, looks like it's smooth, and one that's a bit rough going. So what's the difference between these two?
So what you're holding in your hands, they are both gel implants. This is the generation 4 implant. This is the generation 5. Slight differences between the two. They're both gel. If I were to take a scissor and cut this one in half, it's not going to run all over the floor. It's got very, it's not...
It's like Jell-O.
Exactly. Okay. It stays together. This one even more so. You can feel it. It's a little bit thicker.
Yes.
If I were to cut this in half, it actually, you can see that definite line between the two. It's built like a gummy bear. This is that gummy bear implant that you're hearing talked about in the news today. The different textures, this one's a smooth, this one has a texture to it. If you look at the side profile, one of them looks like an actual breast shape. It's shaped in a teardrop. The texture acts to keep it positioned on the chest so that we don't have problems with rotation.
Right, yeah, so this doesn't end up at the top.
That doesn't end up at the top or the side. That looks a little bit awkward. Whereas the round doesn't matter. If it turns within the body, it maintains the same shape.
Now, since this has a more natural look, would you think is this the obvious choice?
Well, I think that what I find, I use a lot of the gummy bear, the implant that you're holding now, for reconstruction patients. So we probably use it in about 80% of our patients and able to get a very nice look after reconstruction. In cosmetic surgery, I would say it's not as a big part of our practice. Most people these days are still using the traditional round implant. But it really depends on what is the appearance that the person is trying to achieve. So for somebody who comes in and says, I want the most natural look I can possibly get with a very smooth transition where there's no roundness at all that people typically associate with implants, then you might go to the shaped implant. For most people, though, the round implant generally tends to be a really good choice.
Why is that?
Well, it's been around for a long time, and most people are able to achieve a really pretty look. Then it comes down to picking the right implant. So we can, there's a lot of different techniques that we use to assess somebody to figure out what's the perfect implant. Because at the end of the day, most people are coming in, their main concern is, how do I find that perfect implant which gives me the look that I want? And
Right.
Dr. Gaon can really talk to you about how we do that.
Now, sometimes we tend to associate, having the nice big round breasts for people who are, kind of arm candy wives, so to say. Is it really affordable? Is it not affordable? Can it just be for the average woman, goes to church on Sundays?
Absolutely. It's an absolutely affordable procedure. It's very safe. It's very quick. There's quick recovery. And nowadays we have the advantage of an entire slew of different devices that are customized to each individual patient. In the past, we used to have 3 choices for breast augmentation: small, medium, large. Now we measure base diameter, we measure how much projection the woman wants, and we use a lot of trying on the implants with sizing bras, and now 3D technology as well, where we take a picture of the patient, we rotate that in 3-dimensional space on the computer, and we have every different style, shape, size, variety of implant, and you can preview what you're going to look like with different sized implants.
Wow.
And this is an extremely powerful tool, and that oftentimes guides the choice of, do you want an overly augmented look? Do you want a more softer, natural look? Do you want to maintain a sporty look? Or do you want to go very large in size?
So would you say, in terms of health and aesthetics, is there a perfect size?
I don't think
cup. How about, is there a perfect cup?
It's interesting. I think that as it relates to health, I don't think so. I think that a different size makes sense for different builds and for different desires. So like Dr. Gaon was saying, there's some people who want a very athletic look. They don't want to be overly large. They want to be able to participate in sports without their breast implants hindering them. For other people, maybe they're not as active. They do something else with their lives where they want more attention. They want a larger size. The size isn't really going to impact the health. It's really more of an issue of trying to pick the right size to deliver the goal for that particular patient.
What would be the average recovery time for augmentation?
I've had patients who've gone out dancing by the end of the week, and some that are still a little bit sore by the end of week 2. But again, it's not something that's going to take you out of your life to where you have to take weeks and weeks off of work before going back and enjoying the activities you like most.
Okay, well, thank you, Dr. Gaon. Thank you, Dr. West. If you'd like more information, please check out their website at finesseplasticsurgery.com.